Hi, this is my Foley catheter redo. So first things I'd want to do is verify my doctor order, make sure I have the correct procedure to the correct patient. Next, I'm going to gather my supplies. So here I've got my catheter tray, I've got my catheter, 12 French, that was on the order. I've got my Pericare, I've got sterile gloves, and my stat lock. So great, I'm going to wash my hands, and I'm going to go to my patient's room. So knock knock, good morning, how are you doing, Mrs. Smith? My name is Monique, I'll be your student practical nurse today. So how are you feeling? Do you have any pain? No? Okay, great. So I would make sure I'd be providing privacy at this time, making sure all my curtains and doors are closed. I would verify my patients, so can I get your first name and last name and date of birth? All right, great, so that matches my orders, so we're good to continue. I would ask my patient about any known allergies they have, specifically iodine and latex are important to ask because that is something we're using. I would go ahead and ask or explain to my patient the procedure. So we will be inserting a Foley catheter, so that will be able to drain your urine or bladder of urine with ease. And I would just grab my patient's consent as well. So like, I continue with the procedure. Do you have any questions? Can I answer any more questions about the procedure or what a Foley is for? No? Okay, so then I could go ahead and get myself set up. I would bring my bed up to working height. I would put my rails down, and I would lay the patient down and put them in the dorsal recumbent position for a female. So that's knees apart, feet together in a frog shape. All right, great. I would just get my patient set up as well. Further, I would make sure that the blanket's all down. I could put a bath towel on my patient's upper section of their body just to keep them comfortable and warm. That's also important. So I'd go ahead and wash my hands again after touching my patient. So I would just explain that we're just going to do some Pericare first. So, all right. I would put on some fresh gloves at this point as well. And then I would just go ahead and get myself set up. So I've got a basin of water. I've got clean rates. So when we're doing Pericare on a woman, it's the furthest labia on the outside. We're going to want to use different sections of the cloth, different cloths, make sure we're not contaminating. Right? Okay, new cloths when we need to. We do the in-ear folds as now. Then we're going to do right down the middle. And just make sure. While we're doing this, we're going to want to ensure to identify our urethra and our urinary meatus. We're going to also be checking for any redness, pain, tenderness, any discharge we can see, any lesions. We're just going to take a really good look so that when we're ready to insert the catheter, we have a good idea of what we're working with. We're also going to want to dry the area once we're done washing. That's also important. Alright, so we'll put that to the side. I would wash my hands again. Checking on my patient. How you doing? Still feeling good? Alright. So I would just instruct them I'm going to be starting the procedure soon. So first things first, I can set up my sterile field. So with my catheter tray, I'm just going to open it away from me. And I'm going to be sure only to touch the very edge. We have our 1 inch on sterile border. So now I've come this far, I can grab my tongs and I can continue with that. So I've got my garbage, I'm going to pull that out. I'm going to put it to the side and set it up later. I've got my drapes. I'm just going to put those within my sterile field. And I'm sure not to touch anything other than with my sterile forceps. I've got my swabs. And I've got my other gear in here too, which I will grab. I've got my saline. I've got more forceps. And I've got my lube. Again, just getting myself all set up so that I'm good to go. Next, I'm going to want to banana peel my catheter open. So, I want my catheter here. I would banana peel it open. And then just using my forceps, I can go ahead and reach in and grab it, making sure I don't touch anything else. And keep So I would just put that in the tray for now. Dispose of that. So now that's good. I'm going to set up my garbage. So now that I'm set up for my catheterization, I can put on my sterile gloves. So I'm going to wash my hands again. I'm going to grab my gloves. I'm going to open them without touching the inside of the paper. I'm going to use my dominant hand first. Reach in. Just grab the very inside of the cuff. Pull back. My 3 fingers. I'm going to pull that side in. So now I have sterile hands. I'm just pinching the inside of the sterile border. And without breaking sterility, I'm just going to pull that back to give myself some room to work here. So now I'm ready. First thing I'm going to do, I'm going to open my loop and I'm going to pour some out here for myself. I'm going to also drape my patient at this time. So just grabbing a corner, even though I do have sterile ones, but it's best to just grab the borders. I'm going to go shiny side down. I'm going to just, without touching my patient or any bedding or anything, I'm just going to put that right under beside the bum. I am going to drape my patient now with the other drape as well. While only, I'm going to just grab the corner, let it fall open. So we're going to go shiny side down. We're going to use the triangles and we're going to just put that on the inside of their thighs so we get a good fit over the perineum. Alright, so again, not touching my patient, not touching any bedding. So now I'm just going to get my catheter set up as well. I'm going to open my swabs, which I already opened here. And I'm going to grab my saline here. I'm going to recat. I'm just going to get it hooked up, that way I don't have to play with it when I'm doing my insertion. I'm just going to hook it up. Best I can anyways. And just leave it in the tray. Alright. So, I'm actually just going to move my tray if I can. Right there. So that's ready to go. And now, so what we're going to do is we're going to clean the meatus with our iodine swabs. So I'm going to choose my non-dominant hand, my contaminated hand. I'm going to grab the labia and spread it, and I'm going to just hold it now. My hand is contaminated, so I can't use it for the procedure anymore. Which I understand. So next, I would grab my swabs. I would do the same as pericure. I would do the furthest, just once. One. In the garbage. Down on the inside. And down the middle. Again, making sure I'm taking note of the urethra so I can get a good insertion. So now I'm going to grab my catheter about 5 to 7 centimeters down. So typically my syringe would be attached, but it's not because I've already tried this one. So what I would do, I've already got my lube poured out for myself, so I'm just going to dip it in about 3 to 5 centimeters. Make sure that's good. I'm going to put the bottom of it in the tray so that when urine appears, it's in a tray. And I'm just going to instruct my patient to bear down like they're having a bowel movement, to take some big breaths, and now I'm going to be inserting it. So still holding this, I'm going to go in the urethra and I'm going to advance it until urine starts coming up. So in this case, I'm not hooked up to a bag yet, so it's just going to start pouring up into the tray. Okay, great. That means we've made it there. And we're just going to advance it a little further, about 2.5 centimeters. So again, like I said, this was hooked up, but it fell off, so I'm just letting go. Obviously, I wouldn't have. I'm just going to go ahead and inflate the balloon. So, push, push, push. I'm going to be making sure I'm taking note of how much saline I'm using so I can document it later. Alright, so now my balloon is inflated. I'm going to give it a very gentle tug to make sure it's in place still. we're done with that, so I can let go. All right. So now I'm done. I can remove my gloves. So I will wash my hands. I would put on some fresh gloves. And then I don't have any tubing, but I have my drainage bag here, and I would have a tube at this point. Again, I have fresh gloves on. I'm going to hook it up, so I would hook it up to the tubing. I would remove this, and then I could remove all my my drapes here. And then I have my stat lock here, so I'm just going to be securing the catheter to the inside of the patient's leg here, making sure that it's got enough slack so they're not pulling on it at all. And then, again, I would just make sure this is all hooked up properly, there's no kinks in the tubing, and then I would secure it below the bladder, down on the side of their bed, not on the rails, anything like that. Checking on my patient, how you doing? Okay, we're done that. So, Ms. Smith, here I come. I'm going to, again, I could wash my hands, put on fresh gloves as many times as I need to, or as that is necessary. We're going to provide pericare again. So, again, we would do furthest, washing, exchanging cloths, whatever is necessary. We would do the nearest, inner labia folds, and then we would do the middle. And just being very careful with the catheter not to bump it or cause any trauma. So then we're just going to dry it. Make sure it's very dry because moisture equals bacterial growth, which we don't want. All right, so now we're done. Again, I would wash my hands after pericare, put on some fresh gloves. Done with all this here. Checking on my patient, how you doing? I would be then, I can palpate the bladder again, just check if there's any distension still. At this point, the urine should be coming out at a good rate. Everything should be good. There should be no pain. So I could go ahead and get my patient comfortable again. I would put them in the position they'd like, maybe semi-Fowler's, see how they're doing, see if they have any pain. I would put my side rails back up. I would put my bed back into position. And then I can go ahead and just talk to my patient a bit. So I would describe some signs and symptoms of a UTI, which they need to be aware of. So burning when it's peeing, any pressure and pain down there. They need to wash their hands before they touch it. So in the bathroom, they need to keep the area very clean. They should report any pain to the nurse so that we can, again, indication of an infection. So they need to be instructed that the tube and the bag needs to stay below their bladder level. So needs to be below their bed down there. And that they should be drinking lots of fluids just to keep their urine nice and clear and to prevent any bacterial infections. So, and then we will get our patient to do the teach back. So we want them to repeat back what we said to them in their own words, so that we understand, we know that they understand what we've just taught them. All right, so I'll leave the cowbell in place for my patient. I'll make sure they're good. Okay, I will be back in about 10 to 15 minutes, Ms. Smith. So I will go out, I will put all my gear away, I'll dispose of anything I need. So I'll come back in about 10 to 15 minutes, and I'm going to want to check my urine and see how it's looking. So let's look at the COCA, so color, odor, clarity, amount. Make sure it's nice and clear. And that would be it. Just make sure my patient is feeling comfortable, no pain still. For documentation, I would document how my patient tolerated the procedure and their observable understanding of the whole thing and how they take care of it now. And definitely I would want to document the amount of saline instilled into the balloon and make sure that's available for whoever is removing it. Thank you.